asked in the questions that you guys submitted is issues with social media, screen time, and how that really relates to depression and anxiety. And I think this really ties in well with just the events of the pandemic as well, because these are continuing trends. With the pandemic, we've become more and more reliant on screens and these alternative forms of communications and community, just kind of like what we're doing right now. Okay, so this is just a graph of when social media companies were first brought onto the scene. Can you guys see my mouse? Can you guys see that? Good. All right. So you'll see that it started around like 2006, 2008. It really started taking off. And then after that, the generations that went through high school after 2008, around 2010 or so, basically it just exploded. And it's to the point, I think I read the latest stat that I read was like 71% of youth are now on Instagram. And you're basically like a social pariah, even if you're not actively participating on one of these platforms. So again, I just want to, just highlight this burst right here. And then I'm going to show you this right here. So this graph is the percentage of Americans aged 12 to 17 who had at least one major depressive episode in the past year. So what's interesting here is take a look at the time. So 2010, it really starts to explode. And as I mentioned, 2010, iPhones come out. These websites, Facebook, YouTube, they start going with us everywhere within our pockets. And it becomes so ingrained into the lives of our youth. So what's interesting is that if you separate it by girls and boys, look at the rate of depression that has just like exploded for girls, young girls, teenage girls. They've stayed about the same for boys. I mean, it's increased, but it's definitely not as dramatic as girls. So that's very interesting, and we got to ask, like, what is happening here? Okay, so this is basically just a summary of what we talked about from 2010 to 2014. Rates of hospitalization, admission, and self-harm did not increase for. It basically doubled for girls ages 10 to 14. At the same time, girls in Canada, mood disorders and self-harm has similarly increased. So it's not just depression. It seems to be all different mental health issues that our young women are dealing with. Girls in the UK experience very large increases in anxiety, depression, self-harm. Much smaller increase for boys that we talked about. So this isn't just confined to the United States. These social media platforms are ubiquitous. As you guys are well familiar with, it's a worldwide thing now, and it seems to be happening in a bunch of different places. All right. So why are young girls adversely affected? So in summary, I'm not going to read this whole thing, but basically what it's saying is for much more for girls than for boys, these social media platforms, especially stuff like Instagram, it really heightens their level of self-consciousness. And they also spend more time on it. Girls spend much more time on social media platforms than our boys do. So let's see, some of these surveys, daily basis. Yeah, so you started using it on a daily basis. By 2014, 80% of high school students said they use the platforms on a daily basis. And 24% said they're online almost constantly. Okay, so this is the important sentence right here. Notably, girls became much heavier users of the new visually oriented platforms, primarily Instagram, followed by Snapchat, Pinterest, and Tumblr. All right. So I think one of the important things that we need to consider is, when we think about these social media companies, like, what is their main goal? Their main goal is not, they don't really care about our mental health. Well, maybe they do, but it's definitely not one of their driving factors when they're making decisions, right? They're a corporation. We live in a capitalistic society. They're obviously one of the most profitable companies that we have. They've provided a ton of good. That's undeniable, but at the same time, they're driven by profit, right? And how do they profit? They profit from ads. They're basically in the business of attention. They're designed, and their main goal is to keep you hooked. So that's their goal. So our mental health is suffering as a result, and it's not surprising because that's not their main concern. Okay. All right. So Snapchat's filters. keep the focus on the face, where Instagram focuses heavily on the body and the lifestyle. So these social media apps, especially Instagram, is becoming about not only, you know, the way you look, but also your lifestyle now. It's literally everything about you, everything that you do is, you know, there's something for comparison there, right? And Theodore Roosevelt, comparison is the thief of joy. Is you know, very human to compare. Just now, our youth are facing pretty much an endless amount of potential people and lifestyles that they can compare themselves to. All right. Okay, so we'll talk more about bullying later on, but of course with social media, bullying is basically in your pocket now. You can't leave it. When you leave from school, it doesn't, you know, there's no escape. So that's also a problem associated with it that may be contributing to some of the rates of anxiety and depression that we're seeing. All right, so what about the boys? What's going on with them that they're not being affected? So basically, boys are also spending increased amount of time looking at screens, but they're just choosing to spend it in a different way. They're far more likely to play video games, you know, whether it be computer games, consoles. Yeah, so in contrast to some of our girls, usually after the games, you know, they may have a bad experience, but they'll think about it for like an hour or two, and then it's over. It's mostly strangers most of the times. You know, you play the game, you go out, it's over. Versus, you know, individuals that spend more time on Instagram, that's more connected to your real life, and there's less of a escape from those some of the things that you may experience on those platforms. Okay, so given that our boys are spending a lot of time on video games, is that a problem? So there seems to be some controversy about this, you know, so there's no clear answer. So it's a yes and a no. So I think the most important distinction that we have to make is there's this thing called active screen time and passive screen time. Passive screen time is basically, you know, when you're passively scrolling through social media, when you're playing simple, mindless games, versus active screen time, which is, you know, like educational games, even team-based games where you're actively communicating with other members of your team. And there's, you know, this cooperative aspect to it. So passive screen time is generally agreed upon that it's a negative thing. Active screen time, there may be some positive aspects to it. However, it becomes problematic when it becomes an addiction, essentially, right? When you become so consumed by these video games that it takes away from your schoolwork, your physical exercise, family events. You're not participating in social activities anymore, right? So when it gets to that point, the benefits of gaming, you know, you're a little bit less sure about them. All right, so like I said, there's some controversy over whether video game addiction is comparable to gambling, drug abuse, or alcoholism. All right, so that's a quote that I put about digital technology for the sake of time. I'm just going to skip through it. So too much screen time has been linked with obesity, poor sleep, insomnia, behavioral problems, loss of social skills, anxiety, depression, and the other ones that are here on the screen. So it's not, you know, just because you're having active screen time, it's not all good. You can still experience some negative effects of it. The key is really to moderate the use and not, you know, let it take control of your life, basically. So it's interesting because, you know, it's a very interesting thing to think about. It's an area of research and emerging interest within the psychiatric community right now. So I just put up the DSM criteria for addiction. So this applies to more substance abuse like alcohol, cocaine use disorder, marijuana use disorder. But if you just read some of this, like it can easily be applied to video games, like taking that substance in larger amounts or for longer than you're meant to. I mean, people play video games a lot longer than they mean to, wanting to cut down or stop using video games, you know, but they can't. Cravings and urges, like you want to go home, just play video games. Okay, so how can we help? Like I said, you know, you want to encourage a balance between screen time and activities that require in-person social interactions. I know it's a little bit more difficult these days with the social distancing, but hopefully, you know, as the pandemic kind of phases out, we can, you know, encourage our youth to participate in activities such as these more and more. Family activities, extracurricular activities. I think this is also a big one. You want to create structured screen-free times, such as during meals, in the mornings or before bedtime. There's also apps out there that can control the length of time that your children can use a device. Big one right here, keep screens out of the bedroom. Bedroom is for sleep only. It can have huge impacts on quality of sleep. Chronic insomnia is also a big problem that's being faced by many individuals today, and I think that's undoubtedly a big contributing factor. All devices that should be charged, leave it outside. Charge it outside the bedroom. I think that's a great start. Okay. So moving on, again, therapy, CBT. There's a lot of CBT-based intervention, and that's been found. This is a very recent study. This article was sent out to me about a week ago. Found moderate success in preventing gaming addiction and internet addiction in at-risk youth. So many benefits to therapy. So many skills that you can use that's applicable to all different aspects of life and challenges that we face. All right, so when we're talking about anxiety and depression, obviously the number one thing, the worst case, is suicide risk. The most severe depression. This is what we're worried about. So when I'm assessing patients for suicide risk, these are some of the things that I'm looking out for. Sex. Males are actually, females attempt suicide more frequently, but males complete them more frequently. So there's also different severities of suicide. I mean, all suicide attempts are terrible, but if you cut your wrist, you're bleeding a little bit, it's very different from somebody that drank a whole bottle of bleach and had to be taken to the ICU and intubated. One could be more considered like, I'm desperate, I need help, please notice me. And and somebody that drank bleach, obviously they really genuinely did not want to continue to live. So there are different degrees that we have to be mindful of. But like I said, every suicide attempt is a tragedy, and we should be working to identify, prevent, and help those individuals. Age. Most highest at-risk age group, teenagers and the elderly population. So today our talk is focused more on the teenage population. History of depression, that's a big one. Number one risk factor is previous suicide attempts. This is the biggest red flags for clinicians. Alcohol and substance abuse, psychosis. If you have a severe psychiatric illness, that can also put you at higher risk. Sickness. So this is just medical sickness. Medical sickness is highly correlated with mental health disorders. Obviously, if you're dealing with a serious illness, that can cause depression. Anxiety is also very highly associated with asthma. If you have COPD and can't breathe, that can launch you into a panic attack. So these things are all related. Organized plan. So one of the things that we ask is down here, stated intent. Do you have any thoughts of hurting yourself? Oh, yes, you do. Do you have a plan? What are you thinking about? So if they have a plan, that's pretty much, most of the times that's going to be, hospitalization. We want that person to go inpatient, get treatment, get therapy. So that's also a very big red flag. No social support. No spouse, you're not married, and you don't have social support. You have very, very few friends. You don't have people that you feel like you can talk to. So I hear this very commonly, and this is a very big issue. People feel isolated. They feel like they don't have anybody that they can reach out to. They don't feel like they're being heard. And again, this is also a big red flag. All right, so what can we do? When we identify that somebody might be at risk of a suicide attempt or just severe depression, these things are all present within our community crisis center. This is basically, you can think about it as a psychiatric emergency department that's just basically tailored and specialized for psychiatric emergencies, and suicide ideation definitely counts as one of those cases. If there is no crisis center, the emergency department. I mean, I see a ton of patients in my emergency department. They'll come in, either they'll come in themselves because they're feeling unsafe, or a family member might have brought them in, right? And then all emergency departments, whether it be by Zoom or in person, they should have a psychiatrist on site that can come and evaluate what the best possible course of action is going to be. Ongoing relationship with a mental health provider. So this is also key because when you have a good relationship, when there's a therapist that you're working with on a daily, on a routine basis, when you've been working with a psychiatrist on a routine basis, and they have a good understanding of who you are, the issues that you're struggling with. When I assess patients in the hospital, I see the records of their outpatient providers. And if I know that they're following up with somebody, I always call them. And I'm never making those decisions by myself. I call the outpatient providers, I call their therapists, I talk to them, I ask them, hey, what is this person normally like? And they're a huge resource for me. And they definitely aid with dealing with psychiatric emergencies. Family support, that's a big one. When you have family members involved, that's always a big positive. Access to weapons, obviously that's one of the questions that we always ask. Do you have access to weapons or guns in the house? Access to firearms is a risk factor as well. So you wanna eliminate as many risks as possible. And text messaging intervention for at-risk youth. So this is one of the newer ideas that's emerging. Just read an article on it recently. And for our youth today, who's more used to these digital platforms, communication by text messaging, they're finding that these platforms are eliminating barriers or any kind of anxiety they feel in terms of reaching out for help. So I think this is something that's emerging and something to look out for in the future. All right, so what about the pandemic? Okay, so the CDC, compared to last year, in the emergency department, visit for suicide attempts amongst teen girls were up more than 50%. So that is, it's an alarming stat. It's very worrisome. Suicidal behaviors amongst high school students has also increased during the decade preceding COVID. So you can tell that it's been a trend that's already been ongoing, but it has been significantly accelerated and exacerbated by the pandemic. So the main issue, Dr. Murthy, he's the general surgeon. He said it's access to care. He said on average, it takes 11 years from the onset of symptoms before a child begins receiving treatment. So that's a long time. So I think, especially with seminars like this, if we can just learn to identify, signs that are alarming, symptoms early on, and get individuals help, at an earlier time, there's a big benefit to be seen from that. Okay. So between April and September of last year, 70% of people reported loneliness or isolation was a top contributing factor to their mental health issues. Like we talked about, people are feeling like their communities and social support systems are breaking down for a lot of youth today. That's not just limited to the youth. It seems to be happening to all different age demographics, but that is a trend that's been happening for decades now. And again, it's even more evident now with the pandemic, with everything going online and people turning to substances as a coping mechanism, and people feeling more and more isolated than ever before. Especially because a lot of our relationships have gone onto these social media platforms, and relationships tend to be very superficial. They're not the deep relationships, within our communities that past generations have had the privilege to have. So that may also be contributing to it as well. All right, so how can we help? We need more community. We got to get our youth and adolescents more connected, more involved. I think some of the initiatives that Esther Ha Foundation has going on, such as a support group, which has been immensely helpful for me when I was a participant. These are still great options. For parents are also encouraged to attend therapy, recognizing our own emotional issues. We may find that they're also impacting our children. And the more that we can recognize and manage issues within ourselves, we're able to spot these emotional issues within our children or other family members and hopefully be helpful. Support groups, already talked about that. Access to culturally competent mental health. So this is also another thing that the general surgeon talked about. And I think, one of the goals of Esther Ha Foundation, especially with the, like myself, I'm immigrated with my parents when I was young. My parents are, more of traditional Korean mindset. I'm pretty much American. There is that cultural divide. I talked to Dr. Chun about this a little bit as well, but my understanding is that, especially, when we're talking about our Flushing, Queens, even New Jersey, Korean American community, there aren't too many providers that have had similar cultural experiences growing up. So just the sheer number, just the sheer shortage of psychiatrists is an issue. And of course, when you're looking for culturally competent psychiatrists, that further exacerbates the shortage. And some of the access, as whether it be economic or extremely hard to get appointments with a psychiatrist these days, takes weeks to months. So these are problems that have to be addressed more on a systemic level that can take longer to change. I think for children, having a good relationship with the school guidance counselor, I think that's huge. We do, as part of our training, we do a lot of children assessment in our emergency departments, and oftentimes they're sent from the school by their guidance counselors. The guidance counselors, because they have ongoing working relationships with the children, they're able to spot out if there's a change in mood, if there's any concern, they'll send them to be evaluated. So when you're working closely with the guidance counselor, that's always a positive. Family support, and encouragement to access resources that are provided by schools, universities, and even nonprofits such as Esther Ha Foundation. There's a lot of resources out there that's being underutilized. So as parents, as family members, as brothers and sisters, if we can encourage our family members struggling to seek the help, that's always a positive. All right, so some of the other things that was mentioned, imposter syndrome. For the sake of time, I'll just kind of go quickly through these. Imposter syndrome, it's not really recognized by the DSM, but it's basically like you feel like you're a fraud. More common with highly achieving individuals. They feel like all the work that they've done is, or the position or whatever success that they were lucky enough to achieve, that they feel like they either got lucky, that they got it by deceiving others into thinking that they're more intelligent. So, like kind of anxiety over those maladaptive ideas. So to a certain extent, it is kind of normal in human-to-human relationships. Up to 70% of people will experience imposter syndrome at least once in their lives. And relationship between imposter syndrome and the following, like depression, anxiety, these are all related and contribute and feed off of one another. How can we help? Again, therapy is going to be very important. There's no specific medication targeted at imposter syndrome, but there's medications to target the associated symptoms, for example, anxiety and depression. So again, the main thing is therapy here. Group sessions are also very valuable. This population benefits a lot from realizing that the issues that they're dealing with, that they're not alone. They're not alone in these issues. And that's not only limited to imposter syndrome, all these other issues that we talked about. Great benefit that comes from, just hearing somebody else talk about their issues and realizing that, hey, like I'm not the only one. Okay, last topic, I believe, is just real quickly, bullying. Bullying, this is basically just a definition. Unwanted aggressive behavior that's intended to cause harm. It's repeated, it happens over and over again. And then there's usually a power imbalance that can be associated with it. All right, so it can take many forms. There's direct, it can be indirect, and now there's cyberbullying. I mean, bullying is a century-old problem. It's just, it's not anything new, but certainly the issues with social media, screens, cell phones, internet has made cyberbullying. That's something relatively new and something that we need to tackle together. Most common places where cyberbullying occurs, basically everywhere. Emails, social media, Reddit, I mean, Snapchat, like everywhere. Yeah, you can't avoid it. So if you're engaging on an online community, engaging in online life, like I would say almost everybody is, you are at risk. All right, so the impacts of bullying: psychological, increased prevalence of depression, anxiety, social damage to social relationships, social withdrawal, that's a big thing, social withdrawal. You can become very isolated if you're a victim of bullying. Physiological, psychosomatic, increased levels of stress, feelings of distress, and it can also manifest in physical symptoms, just like feeling wound up, muscle aches, fatigue, stuff like that. Academic, decreased academic performance, that's understandable why. Sometimes it can lead to wanting to skip out on school and just avoiding school because they're so worried and scared. All right, so How can we help? For youth, we wanna encourage our youth to report instances of bullying to adults. We want to encourage them to stand up to bullying. Physical standing up is not really encouraged, but verbally standing up for yourself if the situation is safe. Obviously, that requires a bit of insight on the part of the victim to recognize when a safe and appropriate situation to verbally stand up for yourself is. And you want to show kindness to all, encourage them to show kindness to all other students. Because students telling a peer to stop bullying has much more impact than adults giving that same advice, right? When it's coming from your peers, it's more likely to make an impact. So you wanna reach out, encourage our youth to reach out to others, their friends who are being bullied, and to take an active part in standing up for them. For parents, many schools have policies in place. It's appropriate to reach out to schools, counselors, and become more involved, and maybe even work towards improving some of these initiatives that are already in place. We can also communicate with other parents and share information and talk to teachers and administrators when they learn about problems that our children may be experiencing. Teach children not to fight back with aggression. I mean, as we all know, like aggression is probably never the right answer. You want to work with our youth to create plans, and you need to teach our children that we can, ways to walk away or avoid bullying situations, and that they can and should talk to an adult, teacher, or parent as soon as possible. And again, just to hammer the point home, therapy. Therapy builds self-confidence, resilience, self-esteem. You can learn different coping mechanisms and how to handle different situations through things like role-playing. So therapy is very, very, very beneficial and highly recommended. And that about wraps it up.